Hello everyone, this is Dr. Fox. Let's talk about the facial fasciae. Fasciae is the plural of fascia. In this video, we're going to describe the distribution of and relative depths of the facial fasciae, especially with regards to other facial structures. So the face, like other regions of the body, is layered in its complexity. The most superficial layer of the body, and this holds true for the face, is the skin. So in the laboratory, when we remove the skin of the face, we'll be able to see the subcutaneous layer. The subcutaneous layer of the face is very different than the subcu of other parts of the body, which tends to be a little more loose and tender, whereas the face is much more dense and full of fibroadipose tissue. So it tends to be a little more compact. And this subcutaneous fibroadipose tissue layer is serving as a connection between the skin of the face, which necessarily must be mobile in order for us to convey expression and emotion, to the muscles and their aponeuroses, or tendon sheets, that are deep to that layer. So immediately deep to the subcutaneous layer is the SMAS, which stands for Superficial Musculo-Aponeurotic System. And depending on the source or your perspective, this superficial musculo-aponeurotic system may be largely connective tissues with some muscle fibers that are coplanar to the muscles of facial expression, i.e. the mimitic muscles, or it could be the mimitic muscles along with their aponeuroses and connective tissues. Either way that you want to look at it, we can consider this all one layer. So the SMAS is largely going to be distributed about the anterior and anterolateral face. So if we were to imagine a layer deep to where I'm circling, that would be the SMAS. Now the next two layers that I'd like to discuss with you are going to pertain to an osteological feature known as the zygomatic arch. The zygomatic arch is, as I'm indicating here with this green line, above the zygomatic arch and coplanar, or in the same level as the SMAS, is the investing fascia of the temporalis muscle that is above the temporal and parietal bones. We call this the temporoparietal fascia. So this is very well named. Again, it's coplanar to the SMAS, superior to the zygomatic arch. So that's going to leave an area that is inferior to the zygomatic arch. So as we'll discuss shortly, there's going to be quite a large major salivary gland there. That large salivary gland is the parotid gland. That parotid gland is going to be glandular epithelium contained in a capsule. And overlaying that capsule, and it's going to be inferior to the zygomatic arch and deep to the SMAS, is something called parotid masseteric fascia. So if I were to draw this, and I'll give you a better visual in a little bit, it would kind of look like that. So it's inferior to the zygomatic arch. It's superficial with respect to the parotid and its capsule, and it tucks under or is deep to the SMAS. And this is going to cover the parotid capsule. It's also going to cover the parotid duct or Stenson's duct. It's also going to cover the masseter muscle, which will be there as well. Now, coming out of the stylomastoid foramen is going to be the facial nerve. And that facial nerve is going to divide up into divisions and then into various branches. And those divisions and branches are going to move through the substance of the parotid gland. And they're going out to innervate those mimitic muscles from their deep surfaces. So they will travel throughout the layers. And then finally, this is something we'll see better in the next slide. There is an area that is anterior to the masseter where there's a buccal space. The floor of that buccal space is the buccinator muscle, and it is going to be occupied largely by the buccal fat pad, which will give structure and a youthful appearance to the face, a more rounded appearance to the face. The floor of that space, that buccal space, is going to be the buccopharyngeal fascia. You may recall the buccopharyngeal fascia is the posterior aspect of that middle layer of the deep cervical fascia. That layer that is the anteriormost boundary of the retropharyngeal space. But let's take a look at this in a little greater detail. So this has that fibroadipose layer removed. It has the skin removed. And so what we're looking at here are layers of the face and the fascia associated with the face. So let's just tip our hat to the fact that we can still see the platysma muscle right there, that tensor of the neck and weak depressor of the mandible. We could see some of the other muscles of facial expression along here as well, all throughout, just to give you an idea of some of their distribution. But color-coded for you are those three fascial layers that we've been discussing. The pink is the SMAS, the blue is the temporoparietal fascia, and the green is the parotid masseteric fascia. So let's take a look at the SMAS there. We can see that it covers the anterior and anterolateral face. We can see that it's coplanar with the temporoparietal fascia. We can not see the zygomatic arch, but we can kind of imagine that zygomatic arch in there. And we can see that the temporoparietal fascia is superior or above that arch. We can see very well, in fact, the parotid gland there. And we can see some of the branches of the facial nerve here in yellow traversing that parotid gland. So they're exiting the substance of that gland all along its superior and medial edge to go out to serve different muscles of facial expression. We can see the parotid or Stenson's duct here. That's heading on down into the buccal space. There's that buccal space. And we can see the buccal fat pad. You may have heard, it's been quite popularly reported in the press that a very common cosmetic procedure is to have the buccal fat pad removed. And when it's removed, this gives more of an angular feature or contour to the face. It's very popular these days among celebrities. The issue with that is that in the absence of the buccal fat pad moving forward, the cheeks begin, especially as people age, to appear sunken. And so this might be a cosmetic procedure that in the youth may to some enhance beauty, but in the same standards that are rather unfairly driving people to this procedure, it may lead to a premature aging of the face, which might be counterproductive to their motivations to performing it in the beginning. Regardless, no judgment there, but it does highlight the importance of the distribution of connective tissues, in particular the buccal fat pad, on the contour of the face. And there are very many other societal implications on how that is viewed and interpreted that are well beyond the learning objectives of this course. But needless to say, we can see that buccal fat pad within the buccal space, and we know that the floor of that buccal space is the buccopharyngeal fascia. So that buccopharyngeal fascia, as we move posteriorly, can communicate with other fascial spaces like lateral pharyngeal spaces and eventually go back to the retropharyngeal space. And if we're talking about the danger space of that retropharyngeal space, that's the space that is posterior to the alar fascia and anterior to the prevertebral fascia, then we have a communication from the face down to the mediastinum of the thoracic cavity, which is where the heart lives. So I hope this gives you some appreciation of the complexity and somewhat of a guide to steer your way through the tall grass of that complexity as we navigate that in the laboratory. Let's take a look at our assessment question. So in areas where the parotid masseteric fascia, the PMF for short, sometimes we also hear this as parotidiomasseteric fascia, but in the areas where the PMF overlaps with the SMAS, what relationship does the PMF have to the SMAS? Is it anterior to the SMAS? Well, nope. At best, it's posterior or lateral to the SMAS. Is it deep to the SMAS? Yeah, that's pretty good. My understanding is that the SMAS overlaps the PMF in areas where they are coincident. C, it is inferior to the SMAS. No, that's not good. Is it superficial to the SMAS? No, we know that the SMAS is just below that subcutaneous layer. And is it superior to the SMAS? Again, no. So the correct answer is where the PMF overlaps with the SMAS, the PMF is deep to the SMAS. Thank you so much for your time, and I look forward to talking to you in the next video.